So our question for this episode is more of a philosophical question. Much like post 9/11, the world is a different place. It will continue to be a different place moving forward. We wanted to talk a little bit about what we think COVID might do to change the world for the better. So I'd like to go first to Professor Kayyem on how she thinks COVID might actually change the world in terms of governance for the better.
Polling has been consistent. 60, 70, 80% of Americans feel like it's too soon to end social distancing. Something about that kind of gives me hope that people do understand the social contract, that they understand their obligations to each other. It doesn't mean we don't have a strong anti-vax movement. We don't have a noisy right-wing movement. We don't have an armed, resistance. But these numbers are pretty shocking when you think about how much the president is pushing opening up. And I think it tells me in the hopeful way that despite America's reputation for not caring about the future or larger issues, I actually think that these numbers actually give me hope. And they give me hope as we open up that maybe it won't be as bad as I'm worried about.
And Dr. Bourdeaux, I know this is an absolutely terribly difficult time for healthcare workers, both physically and emotionally. What are you seeing medically that gives you hope, both in the hospitals and from a public health perspective?
Yeah. So, the adage, it was the best of times, it was the worst of times, definitely applies here. Because so just to focus on the best of times piece, I couldn't agree more strongly with what Juliette just said. We are going to come through this, and there are going to be sort of two big things that come out of this. One is that on a sort of tactical operational level, we're going to have a public health system that we deserve. We've let it kind of wither on the vine, our public health system, and now it is going to, we're making the investments that we need to have something that really underpins human health, human security in this country in a way that we've never seen before. And then the other thing is the more philosophical, broader thing. This is a threat that is a win-win, lose-lose scenario. So it's one in which your neighbor and how well they're doing means, is going to impact how well you're able to do. And all sorts of things, not just in terms of health, but in terms of our economy, in terms of our environment, our environmental policy. And I think we're going to start to really reshape both our health policies, but also our security policies, our intelligence policies, around this very powerful model that has, for lack of a better word, solidarity at its center. And I'm excited about that. I think that's a very wonderful thing to see.
Juliette, what are you doing in the short term to stay safe and sanitary?
So the kids are starting to finish up school in the next couple weeks. And as I said earlier, we're sort of default social distance family, and we will be for some time. Doesn't mean that they can't drive, the ones that are old enough, and the boys have skateboards now, which they love doing, and they can do with masks. But I got with the kids, I know you all think this is for kids, but I got into gaming this weekend, and man, it is so fun. So for all the parents who are like, oh my God, my kids are downstairs gaming, my teenage kids are downstairs gaming, go join them. It takes a while, we're slower, our hand-eye coordination is not as good, but it was super fun, and the kids get a kick out of you coming in last place every single time.
I will also add the millennial plug for Steam has a tabletop gaming service, so you can actually play tabletop games like Monopoly and whatever else you like, and I tried it out this weekend, and it's really fun. So
oh, cool.
Another option as well. Well, thank you both. This has been Questions from Quarantine, and as always, please feel free to hashtag Questions from Quarantine for your chance to be answered next week.